Hello. In this vignette, we'll be talking about direct laryngoscopy. What I'll cover is assembling of your equipment, assuring your patient is obtunded, opening your patient's mouth, implementing laryngoscopy, obtaining the best view, and inserting the ET tube. So, we're going to start with having your personal protective equipment, goggles, gloves, mask. Then you want to make sure equipment is assembled. Your suction, oxygen source, and then your laryngoscope, ET tubes, airways. Alright, from this point, your patient has his IV in and he's being oxygenated. His medications are given through his IV. You're talking to him as he goes to sleep. Sir, you're going to be going to sleep soon? Okay, open your eyes. So you talk to your patient, ask him to open his eyes. If he does not respond, take your fingers, run your fingers across his lashes for a response. If there's no response, get a couple breaths, make sure you have a good airway. Once your patient is properly oxygenated, move your mask, tilt your patient's head back a little bit, take your right hand, insert it into the mouth in a scissors fashion, open the mouth, take your laryngoscope, open your laryngoscope. If you have a straight blade, place it to the right and slide it down the tongue. If it's a curved blade like so, just straight down the tongue. At this point, you want to make sure there's no lips, no gum, no teeth on your blade. Insert your laryngoscope, lift, and get a good visualization of the cords. Once you have good visualization of the cords, you take your ET tube, slide it in from the right, maintaining the good view of the cords. Do not block your cords with your tube. And then you slide in your ET tube. Once your ET tube is in and it goes through the cords, you stop and have someone pull your stylet. And then continue to insert your ET tube until your balloon passes the cords. Take your laryngoscope out, close it up. Inflate your balloon with 10 cc's of air. Connect your circuit. Ventilate your patient. You should be looking for a rise and fall of the chest, condensation on the tube, a feel of the bag, and then tidal CO2. Use your stethoscope and do a 5-point auscultation. Listen to left lung, left, right, and stomach. Once you're sure about placement of your ET tube, grab your tape and tape your tube in place. So what we've covered in this vignette is direct laryngoscopy, assembling of your equipment, assuring the patient is obtunded, opening your patient's mouth, implementing laryngoscopy, obtaining your best view, and insertion of your ET tube.